Hope you can see my slides. Is it seen, Dr. Gupta? Yeah. So let me start by thanking Dr. Banshi Sabu, the outgoing president of RSSDI, and the incoming president, President-elect Dr. Vasant Kumar, and the dynamic secretary of RSSDI, Dr. Sanjay Agarwal, for organizing this brilliant meeting. Is it okay? Everything okay?
Yes. Yes.
So organizing this brilliant meeting. Very difficult to do it in COVID times, and to do it hybrid plus virtual is a big challenge. So congratulations to all of you. It's been an amazing meeting, and I've just had the pleasure of once again listening to Dr. Yajnik and his amazing work. So the topic of my presentation is reversal of diabetes: how, when, and for whom. As Dr. Gupta said, this has been a topic which has been raging. And the reason I'm talking about this nowadays is because, except us, everybody seems to be talking about it. Software engineers, dietitians, everyone else says that the diabetologists only treat. We are the people who reverse diabetes. So I thought that, it's very important for us also to recognize what has been said about reversal, what are the facts, and where, who, when, and for whom. So just so that we are all on the same page, a very simple talk, so that we are all on the same page. We know this natural history of diabetes very well, which means that from the normal glucose tolerance to pre-diabetes to diabetes and the stage of complications. So this is a natural history of diabetes, and we are going from left to right. Now, what about if you go from right to left? Is that possible? Now, that is what is called as reversal of diabetes or remission of diabetes. And if we think that this is a new concept, this very figure was published in 1970s itself from our group, and again in 1980s. At least about 10-15 textbooks have this figure with this reversal already shown. I think before anyone else had talked about it, we had talked about reversing of the diabetes. And these arrows, this is a slide I've been showing for the last 40 years. There's nothing very new in this slide. So reversal can happen. But the reason I'm talking about it now is that I've heard people say that even after 30 years and 40 years of diabetes, you can reverse diabetes. I think that's a bit far-fetched, because once you develop the complications of I've heard people say that even if your eye is affected and your kidney is affected and your heart is affected and your feet are affected, we'll reverse your diabetes. I hope that was true. I don't think that is actually true, because you can see that this reversal arrow, the blue one, only starts at the stage of clinical diabetes. Of course, you are at the stage of pre-diabetes. Nobody is arguing that you can reverse. We have shown it. Others have shown it. Several groups have shown it. The various prevention trials have shown it. Not only not progressing from here to there, but also reversal. So again, to set the record straight, from the clinical diabetes stage, it is possible. Again, it is not possible to reverse certain forms of diabetes. If somebody claims that type 1 diabetes, after somebody's beta cells are completely gone and is on 4 times insulin, I can reverse it. I think only the quacks now talk about that. And I've seen some of my children, unfortunately, children with type 1 diabetes, unfortunately die because they went to such quacks. So we must make it a point, and our voice must be heard, that there are many forms of diabetes which are not reversible, completely not reversible as of now. Maybe 10 years later, 5 years later, we'll be talking about reversal of that also. Today, is it possible? No. So when you talk about reversal of diabetes, we're talking about type 2 diabetes and its related forms like gestational diabetes and a few other types, but mainly about type 2 diabetes. So this is a slide to just tell you that it's been long considered as a progressive condition, and indeed it is in many people. And remember, there's heterogeneity within type 2 diabetes. So it is not that everybody can reverse or everybody will progress. Some people naturally reverse. I've been looking at my series of reversals over the last so many years. Some people without even weight loss just went back. They've had diabetes and they went back. Some of them is clearly stress related. But in others, even without anything, they just seem to go back. They come and they go back. Something has triggered it, and when that goes away, it goes away as well. And in many cases, 50% of individuals require insulin therapy within 10 years. And therefore, it's been traditionally thought that it's treatable, but not curable or not reversible. But here are 5 examples of reversal of diabetes, which you should all know. First is after severe weight loss, and the rest of this talk will be only about that. I don't have the time to talk about post-gestational diabetes, although we're doing a trial there, the living trial with Dr. Nikhil Tandon to see the prevention of diabetes after GDM. After bariatric surgery, it's well known that you get reversal. But again, there is too much of hype around that. We have just published a fairly large series of bariatric surgery. And what we have shown is that only up to 8.5 years duration, they are able to reverse. Otherwise, they need some medication. Of course, the number of medicines will come down after losing 30, 40 kilos in weight. The number of medicines come down. Sometimes they go off insulin. But for reversal, as I'll show you, they should not be on any medication. And that is rare in my experience, even after bariatric surgery, even after losing 30 to 40 kilos. But it can happen. In some cases, early cases, if you do bariatric surgery, you can get reversal. Stress-induced diabetes, we all know. Even during the COVID situation, a lot of people had stress-induced diabetes, just panic, stress, depression. You remove that, give them psychological counseling, stress goes away, diabetes goes away. That's well known, although it's not that common as it's believed to be. Drug-induced diabetes, again, coming back to COVID, steroid use during severe COVID has produced so many cases of diabetes. I'm sure all of you listening would have seen cases of COVID-induced diabetes because of the steroid. And after the steroids were stopped, very often they go back. And so that is another example of reversal or remission. But in the rest of this talk, I'm going to just talk about the severe weight loss because each of these is a topic by itself. Now, there are two definitions put here, and I would think the simplest definition is a recent American Diabetes Association definition of remission. Now, what they have said very clearly is don't use the word reversal because reversal gives an idea. It implies that there is a cure, C-U-R-E, cure, and that cure as of now does not exist even for type 2 diabetes. What you're getting is a remission. And the analogy that they use is cancer. You can have cancer, let's say breast cancer, you treat it, you do surgery, radiotherapy, chemotherapy, hormone therapy, and then you do a PET scan and there is no cancer anywhere in the body. What's happened? That patient has gone into remission. How long can that remission last? Usually a few years. Sometimes it comes back. And when it comes back, we call it as a relapse. And as I'll show you, the same relapse occurs in diabetes also. So that is why the term remission is used. It's just gone into hiding. It has gone into remission. It has not gone away forever. Okay. And I can give you some personal experience. My wife, Rama, whom many of you know, was in remission for 13 years, 13 years. I was told by my oncologist that after 5 years, it's called as a cure. After 10 years, he said she's definitely cured. And after 13 years, the same cancer came back with a vengeance. And therefore, diabetes can also come back with a vengeance at any time. And this has never, ever been described in my knowledge, at least in the Indian circles and in these conferences. And that's why I think you as diabetologists should know about this. So what is the definition of the ADA? You should be in remission, which means a HbA1c less than 6.5 or fasting glucose less than 126 without any medications for at least 3 months. So 3 months for somebody who took medicines, now the medicines are stopped, tablets, insulin, everything stopped. 3 months later, A1C is less than 6.5. They call it as remission. The direct trial, the diadem trial, they actually say it should be 1 year. So these are just random arbitrary definitions which are put. The longer the remission, the better, because after 3 months, it may come back again. But the ADA definition is the simplest. Now, how can you achieve this? There are two routes to achieve it, and proponents of both will swear by it. There are people who swear by the low carbohydrate diet, and quite rightly, because in our country, we eat very high carbohydrate. 45% or more is defined as high carbohydrate diet. In India, we take more like 60, 70, 75%, sometimes even 80% carbohydrate. So very, very high carbohydrate. And that's one of the reasons we have shown in recent trials, longitudinal 15-year follow-up studies, that just polished white rice itself is one of the strong drivers of the diabetes epidemic, apart from lack of physical activity and so on. Moderate carbohydrate is less, and when you come down to very low carbohydrate, it's less than 10% or only 20 to 50 grams per day. So those are proponents of this LCD diet or low carbohydrate diet say, give them virtually no carbs, less than 20 to 50 grams per day. Okay. Now, what this will mean is that there are only 3 components of a diet: protein, carbohydrate, and fat. Now, the protein has gone, you cannot give more than 20% protein. In fact, people don't even eat 8% or 10% protein. If you double that and make it 20, where is the remaining 80% going to come from? If less than 10% is going to come from carbohydrate, 70 to 80% is going to come from fat. So it becomes a very high fat diet. And in my experience, when you start giving these people very high fat diets, their LDL goes up, their triglyceride goes up, and the entire dyslipidemia starts setting in. And this I've seen very commonly. In fact, I've even seen increase in the coronary calcium if for too long you take such high fat diets. But it's very effective. When you cut the carbohydrate suddenly like that, you will get dramatic reversal. Medicines go, HbA1c goes. It's almost like doing a bariatric surgery. The question with the low carbohydrate diet is how long will it last? And how long can you go for the rest of your life? No dosa, no idli, no puri, no chapati, no bread, no rice, no nothing, no millets, no nothing. For the rest of your life, next 50 years, you're going to do that in India. Show me a few people who have done that. It's extremely difficult. After 3 months, 6 months, they say, I cannot. And just eat fat 3 times a day. Well, it's difficult. Let me tell you, it's difficult. Very few people do that. So while it's effective, it's not very sustainable in the long run. And so is the very low calorie diet, the VLCD. Now, the VLCD calorie diet, the very low calorie diet, you have to take less than 800 calories per day. That's practically starvation. That is what Frederick Allen did before insulin was discovered. Children, he starved them and kept them alive for 6 months more or 1 year more. Now, what we are saying is do the same thing now in the modern day. Stop eating and you will regress. Your diabetes will regress. Of course, it will regress. You will see very quick response. The question is, what happens when you start eating more? The diabetes may come back, at least in a large percentage of people. So while very low, in the very low calorie diet, you don't bother about whether they take carbohydrate or protein or fat. You're only going to give them 800 calories. So whatever they take, they can get only that much of it. So these are the two proponents. I have very carefully studied the low calorie diet versus the low carbohydrate diet. There is very little difference between the two in the published studies. Both seem to work equally well or equally badly. Now, this is the famous twin cycle hypothesis of Roy Taylor. It looks very complicated, but I'll make it extremely simple for you. If you eat too much and you don't exercise, you'll have a positive calorie balance. That positive calorie balance will result in more liver fat, and therefore you'll get more triglycerides in the liver. So the excess fat gets converted, the excess calories get converted into fat, and it will be stored in the liver. So you get fatty liver. We all know that. If you do an ultrasound, you'll see grade 1 fatty liver, grade 2 fatty liver. The moment you have positive calorie balance, this will occur. Very soon, this will spill over, and then you'll get the fat in the pancreas also. So once you have fat in the pancreas, the insulin secretion gets affected. Once you have fat in the liver, insulin sensitivity gets affected. So the insulin resistance sets in. So you have both the defects of type 2 diabetes. One, insulin secretion, the other is insulin resistance. Both get amplified when you eat too much or you don't exercise. So the opposite of that is, if you cut down on the calories or you cut down on the carbohydrate, when you cut down the carbohydrate so much, automatically the calories will go down. So when you cut down on the carbohydrate, the liver fat will go, the pancreas fat will go, the insulin sensitivity will improve, the insulin secretion will improve, and therefore your diabetes goes away. It's not a big magic, it can happen. Now, can diabetes actually be reversed by very low calorie diet? There are a lot of studies which have shown that within 7 days, 1 week of a substantial negative calorie balance, somebody is taking 2000 calories, now bring it to 700 calories, okay, or 800 calories. Such a dramatic reduction will lead to a dramatic fall in the liver fat. The liver fat will just go down. Your hepatic insulin sensitivity will improve. And then after 8 weeks, after 2 months, this occurs in 1 week. After 2 months, the pancreatic fat will also go. Here is evidence for that. The very low calorie diet showing you decrease in the fasting glucose, hepatic glucose production going up, hepatic fat going down dramatically within 8 weeks. And you can see that if you measure the fat in the both in diabetic patients and in non-diabetic patients, if you can see that the fat going down. In this case, it was after surgery, but even after any weight loss, you can see the fat going down. And here you can see after 8 weeks, what happens is, now the pancreatic fat has gone down, as I told you. Once the pancreatic fat goes down, you can see the insulin secretion going up. So the insulin, the glucotoxicity has gone, the lipotoxicity has gone, and therefore the pancreas is able to secrete more insulin. Now, did you know that type 2 diabetes is caused by less than 1 gram in the pancreas, 1 gram of fat in the pancreas. We heard a lot about adiposity from Dr. Yajnik, and this is only actually supporting what he said, that 1 gram of fat in the pancreas is enough to produce diabetes. But we have to get rid of that 1 gram of fat. You have to lose about 15 kilos in weight, about 32 pounds you have to lose if that 1 gram of fat has to go, if your reversal has to occur. That was shown actually by the DIRECT trial. DIRECT is called as Direct Remission Clinical Trial, done by Roy Taylor and colleagues. This is the largest study. Most of the other studies I'm not showing you had 8 people, 10 people, 11 people. But the DIRECT trial had almost 300 people. This is the largest trial. And what they did was took people and divide them into a control group and intervention group. In the intervention group, practically starvation diet, they put them on an 800 calorie diet for 3 to 5 months. And then what they saw was how many of them lost weight, how many of them achieved remission. Control group, of course, they did not reduce the calories that much. What happened? What are the results? The results showed that after giving 800 calorie diet, starvation diet, for 3 to 5 months, 46% of the participants in the intervention group achieved remission. That means less than half. 54% failed, that you don't really hear when you read the DIRECT trial. After putting them on a starvation diet, 54% of people refused to get into remission. They could not get remission. And note that 4% in the control group also achieved. So the difference is about 42%. But the point of interest is here. You really have to lose a lot of weight. Now look at those who lost less than 5 kilos in weight. Now what is shown here is at the end of 1 year and at the end of 2 years. How many people had remission? Now if you see those who lost less than 5 kilograms, virtually no remission. If you go to 5 to 10 kilos, little bit more remission. 10 to 15 kilos in weight, it increases further. And then if you go to more than 15 kilos in weight, that means 15, 20, 25 kilos, if you lose in weight, then 86% achieved remission. Even then 14% could not go into remission. After losing 15, 20 kilos, after being on starvation diet for 5 to 5 months, 14% still did not go into remission. So you can see how difficult it is in a clinical trial situation where people are, where they are looking at you, talking to you, goading you to go on to this trial and coaxing you and so on. Even then, there are people who failed to get into remission. And the same people who had the remission, 86%, 16% went off, relapse occurred within 1 more year. Okay, there's only 1 year and there's a second year. So by that time, it's already come down to 70%. To follow them further, I suspect it will come down further. So is it totally sustainable in those who achieved remission? Difficult. But if you say, will it occur in some people? Yes, some people will definitely have remission. But in others, it is difficult even after weight loss. The reason I'm telling you this is because remission and relapse, remission and reversal of diabetes is considered so easy now. Social media is talking about it. Oh, freedom from diabetes, this one, that one. They keep talking all this. It is not easy to achieve this and even more difficult to sustain it. Okay, so the conclusion of the DIRECT study was that about half of people who are overweight and had less than 6 years duration, look at the people who are entered into the trial. Those who failed also, but those who had less duration, they didn't include people who had 15 years duration, 20 years duration, then the results would have been much less impressive. Okay, those who had less than 6 years duration and who had lost 10 kg in weight, at least, about half of them had achieved. The other half failed even in that. Okay, and of course, some recovery of beta cell was shown, which is good. Now, who does a reversal work for? I have made this into an ABCDE mantra so that you understand this very easily. A stands for A1C. If the A1C is not very high, we want it to be 6.5 and below. If it is 7.5, it is 8, it's 8.5, you'll probably get reversal. If somebody with 16 A1C, can they get reversal? Unlikely, because they probably have severe insulin deficiency. And how are you going to just make them lose another 15 kilos in weight when they're already thin? So that brings me to B. B is body weight or BMI. If your BMI is high, if your BMI is 35, 40, 32, 38, something like that, you've got a lot of weight to lose. Your actual weight should be 60, but you're 102 kilos. You've got a lot of weight to lose, 40 kilos. Even if you lose 15 kilos, you may achieve remission. But you should be 60 kilos, but you're 55 kilos, you're a thin Indian. Then what do? How much weight do you lose? How can you lose weight? That's what somebody asked me even yesterday. Somebody asked me, If I have to lose 15 kilos, my weight is already 50. I am diabetic. How will I come down to 35 kilos? No, you can't, sir. You can't reverse diabetes in your case. It's very difficult. That's a painful truth which you have to understand. C is C-peptide or insulin secretion. It has to be good. If your beta cells are all burnt out, completely gone, how can you get reversal? Just by losing 1 gram of fat in the pancreas, if all the beta cells are dead and gone, you cannot get them all back because 1 gram of fat went away. It's not possible. But in the early stages, when you have only 4 or 5 years duration, when your C-peptide is still good, yes, the chance of, so that is the C part. D is duration of diabetes, shorter duration of diabetes. As I mentioned, in my cases of bariatric surgery, only after 8.5 years, up to 8.5 years, reversal was possible. Those who had 10, 15 years duration, they could not. Some of them went off insulin, but they could not go off tablets. They could not get reversal. They could not get 5.6 HbA1c and so on. It was not possible. Okay, so shorter the duration, the better. And the last is E is enthusiasm. If you want somebody to starve for 6 months, 8 months, 1 year, 2 years, 5 years, he better be terribly motivated and enthusiastic. Most people will give up after 2-3 months. And that's a problem with human nature. To continue a diet and to continue an exercise program forever is not something which works. Right from Adam and Eve's time, we have known how difficult it is for humans to follow rules which are told to them. But this ABCDE will roughly tell us who are the people, because we should identify these people who come to us and say, you are only, having 5 years duration, you have a lot of weight to lose, your C-peptide is quite good, and you're a highly motivated, enthusiastic person, your HbA1c is only 8.5, why not we try for remission? So you must start talking to your patients, okay? So note that as we stand today, effectiveness beyond 2 years is limited. We don't have the evidence. More data is needed in ethnically diverse population. We don't have many studies from India. And most importantly, re-reversal of diabetes, the term which I coined, re-reversal of diabetes. You can also call it as a relapse, which is a term used in cancer. Re-reversal of diabetes occurs in a large percentage of people. And I see this day in and day out of people who go for these reversal programs, come back to me with very high sugars. And I'm just going to show you one case, illustrative case. Okay, this is a 35-year-old person who came to me, Mr. C, and he had 6 years duration. So ideal for reversal. He was treated with tablets and insulin. He had a low calorie and a low carbohydrate diet was given. He lost a lot of weight and was very happy that he achieved reversal of diabetes. When these people achieve this reversal, they go overboard. They really go on social media, they give videos, and that will attract another 50 people into that. Then they will give and they will attract another 50 people. That's how this business is kept up, because more and more of the people are attracted by one video shown by somebody. So he was able to stop all tablets and attain remission of diabetes. We are also very happy for him. Okay, now that's his weight. He lost, and he lost it gradually, not over a sudden period of time, almost 2.5 years it took for him, from 123 kilograms in weight, 118, 116, 102, 99. So 24 kilos he lost in weight. So when he lost that 24 kilos, you can see he's still overweight. He's still obese. He's 99, but he's lost 24 kilos. He achieved reversal of diabetes. How did he achieve reversal? That's his HbA1c. From 8.4, 7.7, 7.7, dropped to 5.6, 5.4. He stopped all medications. Everything was stopped. No insulin, no tablets, nothing. HbA1c is 5.4. Clear case of reversal of diabetes. No doubt about it at all, or remission, okay, by any definition. Look at his fasting blood sugar. 132 came down to 89. Postprandial 293 came down to 110. So 89 and 110 without medication is a normal sugar, absolutely normal sugar. Look at the liver function test. When he first came, he had fatty liver, and his SGOT and SGPT were 69 and 94. Now it's come down to 20 and 16, completely normal liver function test. We did the ultrasound, fat is gone. The fat is completely gone. So fatty liver is also reversible by weight loss. Now what happened to him? He stopped all his medication and he forgot about his diabetes. We called him. What happened? Come back. He said, why should I come and see you? I'm cured. I don't have to see you. And when I'm cured, why are you guys disturbing me? I don't have to come back. We said, no, you still come back. We'll make sure that you still continue to be cured. Please come back. He never came back. 9 months later, he sheepishly came back to us. He said, what happened? No, I couldn't sustain that diet and all that. How can I be in starvation all the time. So I started eating. My sugars were completely normal. I started eating. I'm cured. No, once I'm cured, why should I bother? I'm doing this only to get cured. I'm doing this only that I can eat everything. That is why I'm doing it in the first place. What happened to him? His weight went up from 99 to 112. Okay, over a 9-month period. Now, this is only 13 kg weight gain. He had lost 24. So he's still down by about 11 kilos. He is still down. Okay, remember that when I show you the next thing. He has not gained too much. He has not gone to 140 kilos. He's only gained this because he came back. If he had stayed some more, he would have reached 140 kilos. Before he came back, he would reach 140 kilos. It would have been much worse. Luckily, 9 months later, wisdom dawned on him. Let's go and see what's happening. He felt a little unwell. That's why he came. Look at his HbA1c. His worst HbA1c is only 8.6. Now it's 8.4. Now it's 9.6. He has never had that HbA1c in his life. So that's why I said when it comes back with a vengeance. Just like cancer relapses, metastasis, when it occurs, it doesn't occur with one cancer cell went into the liver. No, it metastasizes like a bomb exploding in the body. That's exactly happens when you have a release phenomenon like this. And HbA1c went from 5 to 9.6. That means almost 4.2% increase in A1C over this period. Okay, and that means he's been climbing, and only here he came back. Otherwise, he would have gone to 12 or 14 when he came back. Luckily, he came back here. Look at his fasting blood sugar. 130 was his highest. Now his fasting is 247, almost like his PP sugar earlier. And his postprandial from 110 went to 321. That's his highest ever. He has never reached those levels. He never had such sugars in his life. And here is a man who has gone into remission. We thought his beta cells have all recovered and so on. And this is what happens to them. Now look at his liver function. His SGPT was 94 at the worst, came down to 20. Now it's gone to 152. He had grade 3 fatty liver. All the fat reaccumulated in the liver. When you look at ultrasound, completely no fat. Now all the fat has come back. And in how many months? 9 months time. Okay, that's how fast things can happen. And the SGOT went from 16 to 66, which is again higher than his highest. So his liver function is also the worst. Weight is the worst. And the HbA1c is the worst. And this is what we call as reversal of diabetes. You can call it as relapse of diabetes if you like. If you ask me, is it the only case you've seen? I've seen hundreds of such cases. So I thought at least one I should share. I'm now collecting all this. I'll publish it as a report. But I've seen hundreds of such cases coming. I've never seen this discussed in meetings where people talk about it. I think we should know, we should talk, and we should tell our patients about it. So I'm going to conclude here by saying, on the positive side, conversations with people with type 2 diabetes, which is a targeted population, should include remission. You cannot go and tell somebody who is 40 kilos in weight or 50 kilos in weight after 20 years duration, taking 80 units of insulin, I'll reverse your diabetes. Don't be practical about it. Take the young people, long duration, short duration diabetes, and with good C-peptide. These are people whom you should talk. Are you ready? We'll work with you. We'll help you to lose weight. The dietary approach is less important, which you take. Low calorie diet is okay, low carbohydrate diet is okay. These people will swear by it. I know people will say, just stop milk, diabetes will be cured. Try it. Stop milk and see how that goes. Okay. There are different people who will talk all kinds of nonsense, and they just believe in it so much that they'll keep convincing people. Nothing, no single item will work. Ultimately, it is calories. Programs supporting people is very important because you have to be in touch with them all the time and keep on motivating them like in a clinical trial. Only then they will do it. Otherwise, they'll give up. After 1 month, after 3 weeks, they will give it up. It should be structured, continued, regular support, involving the dietitians for long term. We won't have time to keep on ringing him every single day, finding out what did you eat today, what did you walk today, we won't have time. We need a team to do it, and they can do it. But in many cases, reversal of diabetes occurs, but this is hardly emphasized. And I think it's very important that we start emphasizing this in our discussions. I'll stop there. And if there are any questions, I'm happy.
Thanks.